Today we are here to discuss about emergency contraceptive. So firstly, emergency contraceptive itself is self-explanatory. Emergency is when it is to be used as soon as possible and wherever it is available. Contraception is to prevent pregnancy. So after the act of sexual intercourse, the pregnancy, if it is not desired, we can stop it by stopping the fertilization. We can also stop it by stopping the egg release from the ovaries. We can also stop it by preventing the sperms itself from entering the uterus by making the cervical fluid thick. This all things are done by the emergency contraception. Emergency contraceptives are not 100% effective. Even the most effective contraception method, that is sterilization, also has 0.1% failure rate. No contraception is 100% preventive. In case of emergency contraceptive, it would be better if we go for a permanent solution when we want uh, contraception itself. Yes, uh, it is quite effective if it is used as soon as possible, but it cannot replace the traditional or oral contraceptive pills as well as barriers like condoms. You cannot replace it by just using emergency contraception every time. So it is always better to go for a permanent solution if in case the pregnancy is not desired. Most commonly, it is said that it is to be used as soon as possible. It is most effective as per studies if it is used within 72 hours of the act in case of oral pills. Whereas in case of copper tea, you can delay it till 5 days, but not more than that. Because copper tea, the mechanism of action is that it acts as a mechanical barrier and causes a chemical reaction in the uterus, which prevents the pregnancy from implanting and as well as from growing. So it is better to go for a pill because you don't need a medical practitioner to take a pill. Whereas for copper tea, you will have to go through the medical checkup, see that there are no contraindications for the copper tea use, and then only you can insert. As such, emergency contraceptive works on the mechanism of stopping the process, or stopping the cycle as it is. So it will halt ovulation, that is the process of where the ovaries release the egg in the near the fallopian tube. So that process is stopped by emergency contraception. Makes the uterus or the womb environment unfavorable for the pregnancy. You are just disrupting the natural cycle that is going on. So it will have some side effects. Like the next cycle might get delayed, or you might get an early cycle also. You might have a irregular pattern of cycles for the next few months. Some of them also might have an ovarian cyst also because the ovulation process is stopped, so that turns into a cyst. General side effects can also be nausea, vomiting, mild abdominal or lower abdominal pain. Uh, some patients rarely have burning while urination also, and sometimes patient can also complain of white discharge vaginally. It is always better to use it wisely. And as I always say that prevention is better than cure. So instead of going for emergency contraception, a permanent solution would always be better. Next is, uh, are there any contraindications? Yes, if you are suspecting that you are already pregnant or your cycles have not been very predictable, or there has been a history of you having some ovarian cyst which needs emergency, which needs immediate treatment, or any undiagnosed vaginal bleeding for which the cause is not known yet. So it is better to avoid emergency contraceptives in that uh, place. Also, if you have been recently treated for any infection in your uterus or in your tube or even in your vagina, so it would be better not to use any intrauterine device like copper T as an emergency contraception. Most of the time, yes, you can. As I've already mentioned, all the contraindications and indications are generally well written in the language that is understood by the patient in the leaflet that is provided with the medicine. So we just have to go through it once. And as I always said, that once in a while, use of emergency contraceptive is fine, but you cannot use it as a permanent method, or a choice of contraceptive cannot always be emergency contraception. So yes, it is available easily over the counter in all the medical stores, and even in some nursing homes also have it. So yes, it is available freely. But copper tea is not available. It will be available only in a setup where there is a certified gynecologist who would help you with the process of insertion as well as guide you with the do's and don'ts.